Hello, I'm Dr. Michaeline McGuinty. Today we're delving into a crucial topic, understanding rabies. Rabies is a viral infection that, once symptoms appear, is almost always fatal. It's typically transmitted from animals to humans, primarily through bites. What is rabies? Rabies, a viral infection affecting the nervous system, is primarily transmitted through the saliva of infected animals, usually through bites. Although rare in Canada, understanding how it is transmitted is vital for public health. Once symptoms manifest, rabies is fatal, emphasizing the importance of early intervention and preventative measures. Did you know? Bats, foxes, and badgers are some of the most frequent carriers of the rabies virus, acting as reservoirs in various ecosystems. However, recognizing potential carriers is challenging, as infected animals may not consistently display aggressive behavior. Preventing rabies primarily involves vaccination, especially for individuals at high risk, such as those working directly with animals. It is also important to vaccinate pets against rabies to protect them and their owners. In North America, domestic animals are typically vaccinated, but extra precautions are necessary when traveling to regions with a higher prevalence of rabies. Avoid interacting closely with dogs and other small animals, no matter how domesticated they might appear. Talk to your healthcare provider about rabies vaccine if you will be traveling. With a 100% fatality rate once clinical symptoms appear, rabies is a formidable threat. Focusing on preventive measures, including vaccination for domestic animals and people at potential risk, and responsible animal interactions will reduce the risk of contracting rabies. Preventative treatment, called post-exposure prophylaxis, can protect an exposed person from going on to develop rabies, but it only works if it is administered very soon after the bite or exposure occurs. If you are bitten by a wild animal, or by a dog or cat you do not know has been vaccinated, you should always go directly to an emergency room or call your local public health unit to determine whether post-exposure prophylaxis is needed to prevent rabies. Most human cases of rabies result from bites by infected dogs, particularly in areas with inadequate vaccination coverage. Avoiding contact with stray animals, ensuring proper vaccination of domestic pets, and seeking medical attention after potential exposure are key strategies in preventing the spread of rabies. In conclusion, rabies is an infection that can be passed to humans through the saliva of infected animals. Although it is rare in North America, it is still present. Always make sure your pets have up-to-date vaccination against rabies. If you or someone you know is bitten by a wild animal or by a potentially unvaccinated pet, always seek advice immediately in your local emergency room or from your local public health unit about whether post-exposure prophylaxis is needed. Preventative treatment after an exposure to rabies will only be effective if administered very soon after the bite, so do not delay seeking this advice. If you might be at risk of encountering rabies because of work with animals or travel to a place where rabies is more common, and you will be in contact with animals, talk to your doctor about rabies vaccination as prevention. Stay informed, stay vigilant, and prioritize timely medical intervention to protect yourself and your community.